Now that he has oxygen, what do you think his O2 sat was prior to the oxygen?
You would not
So
know.
what could we have done before we put the oxygen?
Put the O2 stat
Check his
assessment.
O2 sat. But what if you don't have an O2 sat machine? Are you gonna go waste time to find that O2 sat or to give it the oxygen? So you're gonna give the oxygen, and then of course you're gonna go ahead and check the oxygen saturation. Now the patient is still in distress, isn't he? Right? He's still cold, clammy, can't breathe. What do you want to do next?
Soothe him. Tell him to relax and take
Very
deep
good.
breaths.
You want to make sure that you allay his anxiety. You want to talk
How
to
you
him.
doing, Mr. Frederico? Yeah, it's gonna be okay. We got some oxygen on you to try to get your breathing under control. All right.
Just take nice, slow, deep breaths. If we want to get your oxygen levels up, we want to.
I know.
So, okay, so after you have talked to him and tried to allay his anxiety, because patients who are very anxious, they're using up more oxygen. And you want to make sure, just don't focus on the nursing task, focus on the human being, real skills. So now he's breathing a little bit better. We have to give him medications, because we must give this patient medications to get rid of the crackle. So now we need to give him some Lasix. So this was his. We did insert a Foley catheter, and he's not putting out any urine. What color is this urine?
Dark brown.
It's very concentrated, right? So, and the reason is, this patients with heart failure, they tend to hold on to water. So we have to go ahead and give him some Lasix. And I'm going to ask you, here's an IV, and typically I would have to give him, that's how the patient is treated with acute heart failure. They must get IV push, IV Lasix. But if this was a patient, say, in the rehab and nursing home, and he starts to cough for pink photosputum, RN would go ahead and give him the Lasix IV push. And you'd have to go to the emergency box. There are always emergency boxes there that contain certain medication. You'd have to go and get the Lasix, and the RN would push it. If this is in a hospital setting, of course, the RN would go ahead and push it. Say you're working in another facility where there's no RN, or DON is usually an RN. Then you'd have to call 911. So he has his IV. So we go ahead, right, and we pull up the Lasix. And Lasix is what? What kind of medication is Lasix now?
A diuretic.
Diuretic. And do you know the safe dose?
31 milligrams.
IV?
Or IV?
Give me a dose. 40 milligrams. 40 milligrams. Okay. So we pull it up, 40 milligrams, and I go and I make sure that the IV is patent. You always want to check your IV site, because what if it's infiltrated? Always check your IV site when you do your patient assessment. So there I go, and I push the Lasix, I give it to him. And then what's the expected outcome?
Urine output.
Urine output is going to be
Increase.
increase. So what do you need to go back and do?
Check INOs.
So you need to go back and check the amount. And now it's 15 minutes later, and you see it's more, right? And patients who have, it's clear, it's much clearer, and instead of, maybe, how much is that, 180?
Yeah, it went up to about 1,000.
It went up to about 1,000. So this is what we say, we're using the nursing process. Patient comes in with a problem. We identify the problem based on your assessment, and then later on you have to go and do your nursing care plan, because the nursing process is how you're going to take care of your patient. You do the care plan, and the plan for this patient who has pulmonary edema is that the patient will, so you hope that this patient will get rid of the
Edema.
excess fluid and be able to breathe much better. So now we see, you can see the effect. And Lasix works very, very fast. Right? So whenever you give your patient Lasix, you want to check the output. What else would you want to assess?
His lungs.
So now we're going to go back to the lungs. Now is much, much better. So now You want to go back?
Look better.
And he's now laughing, and I'm quite sure pretty soon he'll want a cigarette, right, Mr. Because I remember we talked to you the last time about smoking cessation, and okay. So now let's listen to the lungs, and this is what you should hear after the, go ahead, after you give the diuretics. Wait a minute. You still hear crackles?
No.
Fine crackles. Before he had coarse crackles, now the crackles are fine.
Reduced.
So, you know, he has improved based on his clinical assessment, the assessment that you did after you gave him the treatment. And hopefully you have to document exactly where in the lungs that you heard the crackles. We have to do your anterior assessment, and you're going to listen to all the lobes, and of course